Hello, ladies. So it seems like on our board today that there have been quite a few requests about information on relactation or induced lactation, just depending on what your situation is. Actually, nobody asked about induced lactation. That would imply that you were starting from scratch and have never breastfed or produced breast milk. So there's a few things to think about when you're looking at relactation. Relactation, by definition, is stimulating your breasts in order to begin making milk again if you have already made milk before in the past. Typically, mothers that are within the first 3 weeks of giving birth that are relactating have the best results for a full supply, but that is not across the board. I mean, it's definitely possible to produce breast milk, even a full supply if your baby is older. What is more normal is to perhaps not have a full supply, but either close to it or half of it. It just depends. Every mother is completely different. But what I will say is relactation is not for the faint of heart. It is a bit labor intensive because you're going to be feeding your baby perhaps the way you normally feed your baby, in addition to offering the breast as much as possible, pumping if baby is not willing to breastfeed to bring in a milk supply. So it is a lot. I mean, you're looking at 8 to 12 times a day of needing to nurse and or pump. I relactated when we were in the process of adoption, and I was able to begin within about a week or two, and it had been about 6 months to a year since I'd breastfed my third child, and I was able within 2 weeks to start producing drops, and that's the beginning sign. Now, it may be a lot faster for you, but like I said, it had been a long time since I had produced milk. Okay, so here are the basics. There are a few things to think about. There are a couple of different ways to produce milk again if you haven't in a while or at all. A lot of women will just begin nursing or pumping and aiming for a minimum of 8 to 12 times a day. It's recommended that you put off using pacifiers or swings or other soothers because that can take away from time at breast. That can be really tough if that's a main method of soothing, but you can absolutely choose to keep one of those methods and just use a pump or whatever you feel like might work for your family. So that's one way. That's not using any medications or anything other than a baby or a pump. And make sure that you eat and drink to thirst and hunger. The second way is to use herbs like fenugreek and blessed thistle in conjunction with the nursing and pumping. That will help, it's been shown by research to help increase your milk supply. And then a third way is to use prescription medications such as Reglan or domperidone. We've talked a lot on our site about domperidone and its use, and it does not cross the blood-brain barrier, so it's considered to be the lesser of the two as far as causing side effects or causing issues. But as with any medication, all medications come with potential risks, and benefits, so you need to talk about that with your provider and decide if you feel like that's right for you. So the next thing to consider, and I get my thoughts in order here, is, if you're able to get your baby to breast, if you're having trouble or if your baby's willing, there are a lot of different things that you can do to help with your baby. Before we move on to that, there is one more thing. If you haven't produced milk in a long time, the Newman-Goldfarb method is very successful. It has a really high success rate. It involves basically taking birth control pills to kind of stimulate your body, simulating a pregnancy with an abrupt cessation, and then taking domperidone and pumping. I was not able to do that protocol when we were adopting because I didn't have much time. When we thought we would get the baby, I had about a month maybe, and so I didn't use that method. And also, I think in our group we tend to be pretty naturally minded, so that might not be something that someone wants to try. But I wanted to throw it out there, and I can post the link for it if anybody is interested. Anyway, so moving back, I will also be sure to post some other good ways to help encourage baby to nurse if that baby has not been nursing. A lot of people find that if you are willing to use other feeding methods besides a bottle, which is the typical way babies feed, other feeding methods can include using a syringe, a cup, an SNS, which is the supplemental nursing system. If you're willing to use those methods while you're in the process of relactation to get breast milk or formula into your baby, then it typically has been shown to make the transition easier. So it's something to consider. Again, that might be really overwhelming for some moms to imagine trying to do, and I totally get that, but just laying out the facts for you. I think that's it as far as the basics are concerned. If you have any other questions, you feel free to message me or call me 706-978-2407. And I'd be more than happy to talk with you at length about your options and help you kind of figure out what you feel like would be the best way to relactate if you'd like to. So anyway, God bless. Have a great day. See you later.